Hello and welcome to Monash Health. This video is designed to take you through important information to prepare you for your upcoming joint replacement surgery. There are a few things that you will need to do to prepare you for your stay in hospital and to maximize your recovery. The team here are trained to take excellent care of you before, during, and after your operation. You need to be motivated to have this surgery and be an active participant in your recovery.
Things you must do to prepare for your upcoming surgery. 1. Follow the instructions given at your pre-admission clinic regarding fasting and the pre-operative wash. 2. Make sure you get your bloods prior to coming to hospital and notify the medical teams of any cuts, scrapes, or areas of redness on your skin. 3. Pack your hospital bag. Bring loose clothing, underwear, pyjamas, comfortable shoes or slippers with a closed back as well as toiletries. 4. Bring any medications you are currently taking or a medication list from your doctor or pharmacist. 5. Please do not bring any valuables to hospital. 6. Arrange your transport home from hospital. As part of your planned admission, there will be a planned time of day for you to leave hospital. 7. Also plan for transport to follow-up appointments as you won't be able to drive following surgery. 8. If possible, book a GP appointment within 2 weeks following your surgery for a medication and wound review.
As occupational therapists, our role is to ensure that you can complete personal care and activities that are important to you upon returning home. Some things you can do to prepare: be as fit as possible prior to your surgery. Minimise any hazards in your home that may cause trips or falls. This includes picking up loose rugs, mats or cables, ensuring you have clear pathways in each room and adequate access to necessary items and areas. Consider the layout of commonly used items within the household. For example, ensure toiletries, towels and clothes can be reached without bending or reaching too far, and ensure you have slip-resistant mats outside your shower. You may need some equipment such as over-the-toilet frames or shower stools and long-handled aids to help you with your recovery and make everyday tasks such as showering and dressing easier. If required, we can provide you with this equipment. Ensure you have suitable seating at home for both the lounge and dining areas. Low chairs or couches may be difficult to sit in and stand from. Chairs with armrests can assist you to lever yourself up and down from the chair. Before coming to hospital, complete physical household tasks that may be difficult for the first few days once returning home. This includes household cleaning, gardening and laundry. Plan your meals ahead. This includes preparing frozen meals that can be reheated, arranging family or friends to supply meals, or using a food delivery service. If possible, arrange for family or friends to stay with you or visit you following your return home to assist you.
Total knee replacement is a procedure designed to relieve pain and improve function for those suffering from advanced arthritis of the knee. The procedure involves removing the damaged surfaces of the knee joint and replacing them with metal implants.
Following your knee replacement, your new joint can be difficult to bend and straighten. It is important to start moving your knee as soon as possible following surgery so you regain the movement. A common side effect of any surgery is pain and swelling. You must take regular and adequate pain relief to be able to complete your exercises and to be able to walk. The nursing staff will provide regular pain medication. You must ask for more if you are still in pain or unable to complete exercises and walking. An ice pack can also be provided to help reduce swelling in your knee. A knee can quickly become stiff if not exercised appropriately following surgery. To prevent stiffness, you need to complete exercises multiple times throughout the day after your surgery. The physiotherapist will guide you through your exercises when they see you on the ward. Throughout, it is your responsibility to do your exercises. You will be given these exercises before your surgery at pre-admission clinic. You should start them as soon as you receive them in preparation for your surgery. After surgery, it is recommended to sit out of bed as much as possible with your leg bent to assist with your bending. When resting in bed, rest with your leg and knees straight. Avoid putting a towel or pillow under your knee as this will stop your leg from being straight. It is important that your knee can bend and straighten as much as possible before leaving hospital. You should aim to be able to straighten your knee completely and bend to 90 degrees before going home. Your physiotherapist will measure this.
Following your joint replacement, you'll be admitted to the orthopaedic ward and monitored by the orthopaedic medical team. There will be many staff who will be involved in your care following surgery, including nurses who will help your recovery from the anaesthetic by ensuring the pain is managed and your body is functioning optimally after surgery. A physiotherapist who will educate you on how to move after your surgery. Occupational therapist who will help you re-engage in everyday activity and assist you in managing your day-to-day at home. Acute pain services who will help assist in managing your pain after surgery. Our nursing staff will help look after you by assisting with medications and removing any lines or attachments. Please advise your nurse if you feel any pain or nausea. Initially, nursing staff will assist you with your personal hygiene, but will then encourage you to be more independent. Following your surgery, you will need an X-ray and bloods to be taken. It is normal to feel pain following your surgery, but it will be different from the pain you usually feel at home. To understand how much pain, the nursing staff will ask you questions such as how bad is the pain or how much does it hurt, and they will ask you to rate your pain on a scale. By keeping the nurse informed of pain levels when moving around, we will be able to work out the best regime to minimise and manage your pain, to allow you to move around and actively participate in physiotherapy, occupational therapy, and your personal hygiene. We will aim to keep your pain at a 4 out of 10 or below. Regular medicine is needed to minimise pain. Please don't hesitate to ask for medicine if you need it. We recommend taking medicine 45 minutes before you do tasks such as showering, walking, or exercising. An ice pack and distractions such as TV, music, or friends can help reduce pain. Pain will improve each day, however, you can anticipate some pain for approximately 6 weeks following your surgery. You will be provided with adequate medication on discharge to manage your pain. Your GP will also assist you with pain medication following your return home.
You will be seen by a physiotherapist the day of or the first day after surgery. A physiotherapist will show you how to move around safely and teach you exercises to improve your joint mobility. You can expect to walk with an aid, such as a frame or crutches, and you will start sitting out of bed with our assistance, either on the day of surgery or the day after. You will be seen at least twice each day, aiming to progress your mobility each time. This will include walking, negotiating stairs, and working through an exercise program. If you're an active participant in your therapy, you will speed up your recovery significantly.
The information you provide to the allied health team member at pre-admission clinic will then predict your length of stay after your surgery. The physiotherapist or occupational therapist at pre-admission clinic will advise you of your length of stay. You will recover better in your own home environment as you will do more for yourself and be at less of a risk of getting an infection. You will be deemed ready for discharge home once you meet a set criterion, including getting in and out of bed, going to the bathroom, walking with an aid, and negotiate stairs if required. You may be anxious about returning home. However, the team caring for you are experts in ensuring you're ready for home.
Physiotherapy will provide and teach you a home exercise program prior to going home. We recommend taking regular pain relief before completing your exercises at home. Most people will be referred to a community rehabilitation centre for ongoing physiotherapy. At community rehabilitation, the physiotherapist will progress your walking and exercise program and discuss returning to work, hobbies, or sport. You will likely need to use crutches for 3 to 6 weeks after your surgery, and you can anticipate needing physiotherapy for 6 to 12 weeks following your operation. Most patients return to routine daily activities within 6 to 12 weeks after surgery. Every patient is different.
How long does swelling take to go away? It takes an average of 6 to 12 weeks for swelling to go down after a joint replacement surgery. When to be concerned, post-surgery complications are rare. However, we ask you to please represent to the emergency department for assessment by the orthopaedic team if you develop any of the following signs or symptoms. a temperature higher than 38.5, continued wound ooze, heavy bleeding from the incision site or pus, redness around your incision site which is spreading, swelling, warmth or pain in the calf or ankle of either leg, fever, sweating, shivers or chills, shortness of breath or any difficulties breathing, severe pain or tenderness that is not controlled with pain medication. Returning to water activities. You won't be able to return to hydrotherapy or swimming until the wound is completely healed. Please seek clearance from your surgeon before your return.
When can I start driving? You may not be covered by insurance if you drive during the 6 weeks after your surgery. For this reason, we recommend that you do not drive during this time unless your doctor has given you medical clearance. Please seek medical clearance from a doctor before returning to driving. When can I go back to work? The time you'll need to take off work depends on what you do in your job. You may be able to go back to a desk job in 3 to 4 weeks. A more physical job may take 6 to 12 weeks depending on what you need to do. Your community physiotherapist will be able to guide you.
Now that you have watched this video, it is important to start preparing yourself for your surgery and recovery. The allied health clinician at the pre-admission clinic will inform you about your length of stay in hospital.
You can start your recovery today. The fitter you are before your surgery, the better and quicker you will recover. Commence the exercises provided at pre-admission clinic before surgery. If you can, consider seeing a physiotherapist to assist with the pre-rehabilitation exercise program. Please speak with your GP about referring you to a local physiotherapist to facilitate this. Remember, if you're an active participant and are diligent with your exercises and pain medication, your outcomes will be far more positive. Thanks so much for watching. We look forward to working with you after your surgery.